the federal government decided the public health emergency is coming to an end this past April. And so that has meant some shifts in the resources that Virginians have access to. Medicaid unwinding is something that probably everybody has heard about in this audience, at least, where for 3 years, we were not able by federal rules to take anybody off of the Medicaid rolls. And that was done for a really important reason. We didn't want people to lose their Medicaid coverage, their healthcare coverage in the midst of a public health emergency. But what that now means is that in Virginia, we've got 2.2 million people who are on the Medicaid rolls. And just as a point of comparison, normally that's around 1.5 or 1.6 million. And now the Department of Medicaid Assistance Services and the Department of Social Services have the unenviable task of redetermining all 2.2 million of those Virginians to right-size the Medicaid rolls. So that's going to be an enormous amount of work in this upcoming year. That got underway in April, and so we're still in the very beginning stages of that. But there's some really important aspects that I think our community needs to know about and care about as people are going through that redetermination process. There have also been shifts to the SNAP, or the Supplemental Nutrition Assistance Program, or EBT benefits, as people know them, where during the public health emergency, people were getting the maximum allotment. So if you qualified for SNAP at all, you would get the maximum amount of SNAP dollars available to you. As of March, that's no longer the case. And that's really significant for many people across the state, particularly our senior population. You may have had seniors living on their own who qualified for a maximum allotment of around $200 a month. And now that the public health emergency has gone away, that goes down to what their actual sort of non-emergency eligibility is, and that could be somewhere as low as $15 to $20 a month. So a really significant shift to access to money for food for that population. And so I do think there's a really important role that funders can play in helping connect with their local communities, understanding how this is impacting residents on the ground, trying to increase outreach and potentially even fund more public relations, more opportunities to get the information out there. As much as we have put into ads, radio ads, social media, you can't replace the personal touch that folks on the ground have. And so nonprofit organizations that are serving low-income Virginians, community health worker and community navigator roles, those are going to be really important over the course of the next year to ensure that as few people as possible fall off the Medicaid roll. And so